Well, good morning, everyone. Glenn, I too watched Heartbroken on Sunday, but I got my Bruins colors on today. We're moving on. Moving on to our next team and looking forward to the start of football season next year. Bobby, in all seriousness, thank you so much for inviting me here today. Glenn, members of MassBio, it is terrific to be here at this breakfast with all of you. A couple of weeks ago, I had an opportunity to sit down with folks from MassBio. They sat down with folks on our team, and it was terrific at that time and now. We are here to listen, we are here to learn, and we are here to work together. As Bob mentioned, we are facing some seemingly intractable problems, but as I look out across this room and I think about what your companies, what your industries, what your organizations are all about, and the brain power there is no better audience, no better collection of folks to think about how we're going to work our way through some of these difficult challenges that are facing us. I'm also delighted to be here with members of my team. I am grateful to them for all that they do. Many of you have come to know them or work with them over recent weeks or months. I want that to continue. We are all here to serve for you. It is really important to me that we have open lines of communication with all of you between our offices and your companies. We've already reached out, as I said, and sat down with many of you. We'll continue to look for opportunities to do more of that. I really want that to continue. Let me say at the outset that I understand full well that you and your companies are some of the biggest reasons that Massachusetts is a leader in innovation, biotechnology, healthcare, and the creation of life-changing and indeed life-altering medications, devices, and technologies, all of which have had such a profound and positive impact, not just on folks in this state, but on folks and families across this world, and that is absolutely incredible, an epicenter indeed. I also want to say at the outset, I have to begin with a few disclaimers, I guess, as lawyers are wont to do. Look, I was a liberal arts major. Worse yet, I was a liberal arts sort of kid. Worse yet, I suppose, for some of you, I was a government major. I struggled to fulfill my science core classes before graduation. I remember cramming for an astronomy exam sometime late in the second semester of my senior year, but we made it through. But I don't want that to scare any of you. I want you to know that despite my lack of education and formal training, I do come with deep admiration, regard, and respect for all that you do, for the work that you do, work that has made Massachusetts the life sciences, biotechnology, and healthcare capital of the world. Work that, in addition to growing a thriving and robust economy, attracting the best minds and talents to our state for schools, for careers, has led the way in research and development, ideas, and innovation. And work that, most importantly, is literally changing lives and building a healthier, more promising future for all who inhabit this planet. I also understand that despite what you have built and established, your businesses are fragile. Your organizations are fragile in the sense that you're looking to navigate difficult, long, and often expensive journeys. The reward is great, but so are the risks, the setbacks, and the challenges. You need support when it comes to workforce development, an education system designed to help fill those jobs. You need support on immigration reform. We need that as a country for a whole lot of reasons, and I know you need it so that you can not only harness talent from across our seas, but that talent can actually stay here once they become educated. And of course, you need support on the state level, support for our Life Sciences Center, but also from the federal government when it comes to funding for research and innovation. And let me be clear, folks, my office is here to work with you. Now, speaking of my office, a week ago, we celebrated our first anniversary. I asked what you give, what you get. I think it's paper on the first anniversary. We get a lot of paper in the office. I got to tell you how quickly it has gone. It absolutely blows my mind how quickly this past year has gone. I am grateful every day to serve as Attorney General, grateful to work with the colleagues that I work with in the Attorney General's office, and great to find ways to collaborate and work with so many across government and beyond. Now look, when I started, I had a sense of some things that we'd be taking on and tackling in the office: opioid abuse, gun violence, criminal justice reform, burgeoning student loans. There were also some things that I never anticipated dealing with. Hello, daily fantasy sports. Be careful. One thing I can tell you, though, is that I absolutely love my job. And as I say, it's an amazing opportunity to serve. I thought I'd use this time this morning to give you a little bit of a sense of how we try to approach things in the office, and also to talk about a couple of issues that we've been working on that I believe we can partner on and really have an honest conversation about. We've been working literally from day one after the election to build an office that is fair, that is accessible, and that is responsive. That's really important to me. My door is open, my team's door is open, and I hope, to the extent you haven't already, that you introduce yourselves to members of my team, grab a business card, and take that with you. My approach when it comes to the business community, as I've said in the past, is as follows. I believe our job is to listen. We don't pretend to have all the answers. I certainly don't have all the answers. It is important that we listen, that we learn, that we be responsive, and that as we think about things, as we make decisions in the Attorney General's office, that we communicate clearly what it is that we're doing and why it is we're doing what we're doing. Today, we're going to spend a little bit of time, and I'd like to spend a little bit of time touching on the very issues that are the subject of this morning's panel discussion: the opiate crisis and healthcare costs, quality, and access. Now, I don't need to tell anyone in this room how devastating this unprecedented public health crisis has been for folks here in the state. We know that prescription and heroin are claiming the lives of 4 people a day in Massachusetts. I won't ask for a show of hands in this room, but I have been in enough rooms to know that if I did, just about every hand would go up if I asked, do you know someone directly or indirectly who has been dealing with this disease? As a state, we've begun tackling this crisis from a number of angles, and I just want to first of all acknowledge Secretary Mary Lou Sutters, the hardest working person in state government, who really has been on the forefront of a lot of change. An incredibly difficult job to be the Secretary of Health and Human Services in the state, particularly at this time, and it has been just terrific to have your leadership, Mary Lou, on so many issues just this week, working with the legislature in making sure that we're no longer sending women to Framingham State Prison for treatment that they weren't receiving, that they desperately needed. And on so many fronts, you and your team have really led, and I appreciate that, and I appreciate the governor's leadership as well. I also want to thank our colleagues in the legislature. There are so many here, Bob. Thank you so much for acknowledging everybody, because I get myself in trouble if that had been left to me. Oh, well, that's all right. You can handle that. It won't be the first time. Folks in the legislature, I know so many of you have been dealing with this. You see it, you live it, you breathe it in your districts, and I really appreciate all that you've worked with us on to address this issue. I know we've got the legislation working out right now, and it's so desperately needed. And thank you for your care and attention to that issue as well. Now, look, some of the things we're talking about when it comes to this crisis, I know you know that it's important we get after this from multiple angles. We're looking to make treatment more available to those struggling with addiction, and we're educating young people especially about the dangers of these drugs. Police and law enforcement are focused on getting people into treatment, not to jail. And I want to especially acknowledge, because I saw him earlier, Chief Fred Ryan from Arlington. Great example, Chief, where when it comes to overdoses, the chief and his team are sending out social workers on these overdoses so that there's an effort and an attempt made at intervention. And we've seen the Gloucester model, and we've seen that replicated in other communities. And that is the shift in the mentality and the approach in law enforcement. And I applaud that. And speaking of law enforcement and first responders, earlier this year, my office entered into a landmark agreement with the maker of Narcan so that we can get Narcan, life-saving medication, in more hands of more first responders across the state at a cost-effective price. But look, here is where we need to have an honest conversation. And I know this group is up for that. I fundamentally believe that we cannot address this crisis without addressing the culture of prescribing of prescription opioids in this state and across this country. Now, why do I say this? Look, you know the statistics. You've heard me talk about the statistics. The fact that the United States is 5% of the world's population, yet we consume 80% of the world's opioid supply. The fact that right now here in Massachusetts, 4 out of 5 heroin users started with an addiction to prescription drugs. We still prescribe enough opioids in the state for every adult to have a bottle. Here's something you may not know, because it isn't talked about. Heroin is absolutely devastating. It is killing people. It is so sad. It is ravaging families and communities across this state. But I want you to know that last year in Massachusetts, more people died from pill overdoses than died from heroin. More people died from pill overdoses than from heroin, and the rate of opioid-related deaths has increased and remains higher than the rate of increase for heroin deaths over the last 3 years. We have a serious problem. This is an unsustainable situation. We need strong action, and we need it now. So what do we do about it? Look, I've called for much stronger prescribing guidelines for doctors. I see Dr. Dimitri here today, and I appreciate the efforts of the Mass Medical Society, who are in the business of helping people and helping patients. And that's the kind of collaboration and partnership this is going to take. What is it that we need to do to get ourselves to a safer place with this? It's why I support the governor's bill that would set stricter limits on prescribing and dispensing practices. It's why I joined with 30 other attorneys generals to limit the CDC's effort to support, I should say, not limit in any sense of the word, the Centers for Disease Control's efforts to set safe prescribing guidelines. Now, look, I know there has been some pushback against some of this, particularly with respect to guidelines and prescribing practices, and some concern. And I am happy to hear concerns about that. But my view fundamentally remains that if we're going to solve this crisis, the time for action is now, and we need to come together. Other countries have figured out how to manage pain without releasing a flood of addictive and dangerous drugs into the communities. We need to do the same, because if we allow the status quo to continue, addiction's going to continue, and deaths are going to continue. But as I said, this is about a conversation, and I look forward to a conversation and a partnership with all of you on the issues that we can work together on, like the education of young people. I ask for your help in enabling us to achieve that. On the ideas that you have, innovations and ideas about how we can combat addiction, how we can prevent disease from setting in. I ask for your help on all of that. I know these issues are going to be difficult. I hope you'll keep an open mind. I know that we will, because to truly put an end to this epidemic, we're going to need to work together. We're going to need your help. And as I say, there are no greater collection of minds and energies than those in this room and the organizations and the companies that you represent. We can do this. We must do this. And I look forward to working together with all of you in the time ahead. Now, on the issue of healthcare cost, quality, and access, this is a small topic to bite on. Did everyone get their protein and load up? You got a lot to work through in the next couple hours. Look, on healthcare, we're going to need to work as a team as well. You know that, I know that. Many of you in this room are working to develop the next medicines, the next technologies, the next innovations that are going to change the world. 1 in 6, Glenn, that's awesome, right out of Massachusetts. I know that. I know what you're engaged in, and it's so fundamentally important. We need policies to provide the right incentives so that this work can continue into the future. At the same time, we need to be sure that high-quality health care, and that includes access to new and better treatments, really is available to those who need it. Accessible health care means affordable health care, and that includes pharmaceuticals. Now, let me just offer a comment with respect to price and cost and transparency. Information really is what we're talking about. We all know that the public needs information about pricing. I know that as a consumer advocate, when you think about patients and their needs, and I know MassBio is deeply concerned with patients. This is about information. Now, too often, what the public hears out there, particularly in a lot of the rhetoric, is talk about skyrocketing sticker prices. But we haven't, in my view, had a real conversation about what that really means and what goes into it. What are the actual costs of those treatments when you include the negotiated rebates? How are those prices set? How much did it cost to bring the drug to market? How much will the drug save in avoided healthcare costs? What's the cost for treatment compared with years of hospitalizations, ER visits, hospital visits, not to mention the other intangibles for patients and families? What will it take for us to continue to incentivize innovation and development? What are the changes, if any, that we need to make to current payment modalities? Look, I know this business is fragile, that it costs billions to bring a drug to market, that only a few of the drugs or technologies that folks are working on across this city, across this state today, are going to see the light of day in the marketplace. And I know that value maybe isn't talked about as much, or at least in the way that you might think and believe it should be talked about. But let me just say, at bottom, this is about information. We need to have an honest conversation and share the information and answer some of the questions that I posed a minute ago. Because without this type of information, I think it's hard for consumers, it's hard for policymakers, it's hard for insurance companies and others to know whether the costs are too high, too low, or just right. We need to work together to get that information out so we can truly, collectively make some informed decisions. And I look forward, as I say, to beginning that conversation and to continuing that dialogue with you and others. I just want to make a mention of, for a minute, about a particular concern that is confronting us as a state right now, because it's an example of a problem, and a problem that I'd like for us to figure out a way to solve. As some of you know, Gilead Sciences has brought to market an incredible treatment for hepatitis C. We now have a cure for this devastating disease. Unfortunately, the cost of treatments means that patients who need the drugs the most do not have a means to access the medication because of the cost. Now, I'll tell you that people in this state, and I venture to say across this country, are going to need access to this kind of treatment more than ever. Because unfortunately, in no small part due to the heroin crisis and the opioid crisis, we have seen Hep C rates rise across this state. It's scary. It's really scary. It's rapidly spreading. Now, last year, Medicaid spending on these drugs increased sixfold. State Medicaid programs nationwide, just to give you a sense, spent $1.3 billion on Sovaldi. That was before rebates, I acknowledge. But only, in most estimates, accessing just under 3% of the patients who actually would need access to this kind of treatment. At the same time, as I said, Hep C rates have continued to rise. So even though we're spending more on this treatment, the fact of the matter is this is an infectious disease, and the disease is rapidly spreading across this state and in other states. Let me also be clear. Gilead bought a company that made this drug for $11.2 billion. In the first year alone, they sold $12.4 billion worth of the drug. Good for them, and good for those who were able to access it. Today, Gilead is literally making billions in profits. Meanwhile, we've got an infectious disease that's curable rising. More people are sick, more people will die. There has to be a way where inventors of these life-saving drugs can both rightly reap their financial reward, and for us to find a way to get more of these medicines to the patients who need them. It is a problem we need to solve. The status quo, prolonging a terrible infectious disease where a cure is sitting in pills and on pharmacy shelves, is unacceptable. And that's why we've called on Gilead to reconsider and take a look at its pricing structure for Sovaldi and Harvoni. There has to be a better way to balance the cost of research and development, the understandable focus on profit, and making these life-saving drugs more accessible to people. I know more one-time administrations are coming when we look at the approvals for orphan drugs in particular, and I just think it really raises for all of us some serious questions that are hard, but I think we've got to confront. And I'd like to confront those questions together. Raises issues for investors when we think about how they're going to rationalize their investments in new technology. And it raises profound issues of public policy, profound issues when it comes to policy around health, healthcare, and who's going to have access to what in the future. So I raise this, folks. It may be uncomfortable. That's okay. We're used to uncomfortable. I raise it because I fundamentally think it's important. And as I say, I think we've got in Massachusetts a terrific opportunity to work on this together. I know that all of you are about solutions. That's what you do in your businesses, in your companies, in your research. You're about solving problems. And you're about solving some of the most profound problems that confront all of us. You are the doctors and the scientists and the researchers who have made advances in life-saving drugs for previously untreatable diseases. You are the doctors and the scientists who got into this business to help people and to make their lives better. And because of your efforts, Massachusetts has been and will continue to be a leader worldwide. So let's be a leader on this. Let's figure out a way to solve this. I look forward to continuing the dialogue, to continuing the partnership, to continuing the conversation, and I really do appreciate the opportunity to connect with all of you here today. Thanks.